Hi, I'm Dr. Peacock. I wanted to go with you the Peacock Press and some of the variations. The first thing you need to know when you're talking about a Peacock Press, it's only valid with patients who have a rigid rear foot and a flexible forefoot, which are going to be most of your patients with metatarsalgia. Here's a patient I wanted to show you that has, if you put him in neutral position, in root neutral position, we can see that he has, his rear foot is rigid, his forefoot is flexible, and what he also has is his first ray is actually very flexible in the dorsal range, so he has a high SERM-PERM interval, so he gets more dorsiflexion in his first ray. So in this type of patient, when you're doing the Peacock Press test, you want to do 2, 3, and 4, and also press up on the big toe, and that'll give you the most adequate type of test. In patients that have a normal SERM-PERM, they normally will not have a bunion. In these patients, when you do the test, you need to also take your finger and press down on the first ray, which would kind of show you how the peroneus longus is going to act on those patients. The reason the test doesn't work on a flexible forefoot, rear foot, if you have a flexible rear foot, that's when you're going to do hypercure and treatments like that to try to manage your overpronation and your flexibility in your rear foot. So I just want to kind of clear that up. The Peacock Press is valid in that way. Another thing we're trying to do is quantize it. Here's this patient. I got him in the Peacock Press position. You can see when we do the ultrasound in this position, you can see that his second ray is 0.8 from the surface, the third is 0.7, and the fourth is 1.11. So we're trying to quantize this. If you just take your ultrasound and stick it on the foot without putting it into the Peacock Press position, you will not get those same numbers. As a matter of fact, they may actually be level or even not as adequate. What we have to know with metatarsalgia is how the metatarsals are appearing at toe off. That's where the pain is coming from.